assistant professor at Baylor College of Medicine, and I'm in my first year of urology practice. So obesity and diabetes have a very large impact on sexual function. When we think about it, the obesity and diabetes specifically impact the microvascular blood flow, or the small vessels. And some of the most important small vessels in your body are actually responsible for the erections that occur in the penis. And so when you're getting damage to these microvessels in the penis, this is a kind of a slow process, but over time it results in the damage and therefore not functioning vessels. And so oftentimes erectile dysfunction is one of the first kind of symptoms that people will experience with obesity and diabetes, but it's kind of a hallmark of future diseases that are to come. And so a lot of times we get men in our clinics with ED being the first kind of symptom, and we can oftentimes start to talk to them about cardiovascular health and kind of talk to them about saying, hey, this is just your first chance. Let's work on kind of treating these underlying causes to help improve things. GLP-1 medications. In theory, we know that if obesity and diabetes make erectile dysfunction worse, then theoretically, the reversal of those would improve one's erectile dysfunction, or at least maintain a healthy erectile state. The data would show that, and so far it's been in kind of smaller studies, but the data would show that that is indeed happening. That basically, as people's diabetes and obesity improves, their sexual function improves as well. There is maybe a little bit at the very beginning when people are first initially adjusting to these GLP-1 drugs, that there may be slightly decreased desire for sex and kind of as the body's moving around with the different hormones. But ultimately, in the long term, the GLP-1s are improving health, and when your health improves, that improves your sexual health. Sleep becomes a very essential portion of kind of your overall health. When people have poor health, this throws off your hormones. Your body lives in a much more state of fight or flight, and this stress will actually down-regulate a lot of your kind of normal hormones that are essential for sexual function. The other thing that we've found is that certain jobs, things like shift work, these have a major impact not only on your sleep, but also on the kind of way that you perceive kind of your overall well-being. And so, a lot of times we ask men about their sleep apnea, what kind of work do they do, and what are different things that we can kind of help to modify, because again, we're talking about trying to reverse an underlying disease, not just have a quick Band-Aid. And so sleep becomes a very key, important factor that we need to look into when we're talking about erectile dysfunction. With GLP-1s and other weight loss drug medications, we know that as you lose weight, men's testosterone levels will rise. And kind of a rule of thumb is if you lose 10% of your body fat, you'll have about a 100-point increase in your testosterone levels. And so, this is a high motivator factor for many men, because we want to say, hey, we want to make sure that we're optimizing your own, testosterone and hormone production, and therefore, if you lose weight, you're going to be able to make your own, hormones and not necessarily have to be on a medication. When we're specifically talking about GLP-1 inhibitors, we know that it has a major impact on skeletal muscle mass. So while you're losing muscle fat, there's about 30% of that is actually muscle mass that you lose. So it becomes very important that when people are on GLP-1 inhibitors specifically, that they're also doing kind of, working out to maintain that muscle mass, because so much of that muscle mass and testosterone tend to run together. When we talk about lifestyle changes, each person's going to be in their own kind of unique situation. And so, when I talk about it, it's the big three. Are we overweight? Are we healthy? And then how's our sleep patterns? And for some people, they work out and they are otherwise healthy, but they're just not sleeping. And so that's where we have to kind of go for that patient. For other patients, it's kind of a mixture of all three. But the whole kind of goal is to kind of personalize that to that individual person and not just say, oh, you're a healthy person, so there's nothing else that we can do. We kind of have to look and kind of assess the whole person's health to really be able to determine where that can be. But the big three are overall health, obesity, and sleep. There's been some pretty good studies about this. So if you correct someone's sleep apnea, for example, they get on a CPAP machine or something like that, the turnaround is actually within a couple of weeks, where you've started to treat the underlying condition. Then the body responds to that in such a way that can be very positive. So obviously weight loss is more of a continuum, but really the data would show that as you're losing kind of this 10% of your body fat picture, you're starting to get these rises in your testosterone level. And a lot of times for men who are kind of right there on that borderline between low testosterone and kind of a normal testosterone, that can be very evident in their interactions. So it's not something that, in 5 years you're going to have a benefit. It can really be something that as soon as you start those changes, you'll see the benefit fairly soon. So, I think when we're talking about being on these medications for weight loss, you have to kind of make sure that you're still maintaining a healthy diet. Especially with GLP-1 inhibitors, it suppresses your desire to eat. And so some people will just eat less. But it's essential that people maintain a good state of nutrition with these medications, because the last thing we want our body to do is be under, not have enough nutrients. Because under nutrients, to be in a kind of low metabolite state, that overall is not good for your health. And whatever is good for your health is good for your sexual function. And so, working out and eating healthy while you're on these weight loss drugs is very important, because you want to do everything you can to kind of keep yourself kind of in a state of building muscle and not necessarily decaying in your muscle. I think when patients ask me about these kind of questions in clinic, a lot of them are just kind of looking for hope. That a lot of them come into these counters and they're kind of just frustrated. They feel like they've tried a lot of different things and nothing has really helped. And so I think being able to walk them through, being like, hey, this is a drug that actually does work, but it's not just a drug. It's a drug plus a lifestyle change. And when you kind of get guys to buy into this idea that it's a drug plus a lifestyle change, so many more are willing to make that extra effort to make sure that they're keeping their health. And then seeing guys on the other side when they come back and they say, I feel so much better now. It really is very rewarding, and certainly something where they feel more impassioned kind of towards the whole process, because they felt like they did something in it, not just I took a medication and it resolved things. So I think the degree of kind of the feeling better, the putting the work in, and then setting themselves up for a healthy lifestyle. Because really what you do in a 1 to 2 year period isn't as big of important. It's what you do in a 15-year life period that's going to help prevent stroke, heart attacks, and all kinds of major complications down the line.